Hello, everyone. I'm Ghada Majid, the Outreach and Engagement Executive at LAU's Alumni Relations Office. Today's webinar is about navigating mental health challenges in times of war and crisis, led by Dr. Wael Salame. We believe that mental health is as essential as physical health. For that, this session marks the beginning of our alumni webinar series on mental well-being in times of crisis. Let me introduce Dr. Wael Salame, a clinical assistant professor in the Division of Psychiatry at LAU, where he also serves as the Interprofessional Education Program Coordinator and Associate Director of the Clinical Simulation Center. Dr. Salame specializes in internal medicine and psychiatry with particular interest in borderline personality disorder, adolescent psychiatry, impulse control disorders, and interventional psychiatry. He is also passionate about advancing simulation-based medical education. Dr. Salame earned his BS in biology and a teaching diploma from the American University of Beirut in 2008, followed by his MD and clinical simulation diploma from the LAU Jibel and Rosemary Shahouri School of Medicine. He completed his psychiatry residency there in 2018. Dr. Salame is an active international member of both the European Psychiatric Association and the European Council of Neuropsychopharmacology. Dr. Salame, the floor is yours.
All right, so thank you, Ghada, thank you, Abdullah, thank you, Akid, the Alumni Office for organizing this. The way that these sessions, when me and Ghada were discussing, is that I prefer for not to be if you want, an official or a structured presentation, because I think it's very easy at the moment to just list symptoms or list what needs to be done or recommendations from around the world. But in the end, what we are going through today and what we are witnessing definitely doesn't fall under the criteria of certain experiences worldwide or certain past things that have happened across the globe. And based on that, any international recommendations or any international guidelines wouldn't be of any honest value at the moment, because it's very important to try and personalize as much as we can what is happening at the moment. So the way that these sessions, the way that I usually run them is that I start with a very, very, very brief introduction. And every time the introduction changes based on the previous sessions, what ideas were brought up, what topics were raised by previous audience, what challenges maybe they brought to my attention. And then what I will usually do is I'll leave it as a discussion. I'd like to hear any questions or comments that you have. I do not like formal sessions, so I do prefer that whenever you have a question or a comment, that you unmute yourself and you express it. If anybody is not able to use the microphone, then Akid typing in the chat is a possibility. But like I said, I prefer this to be more of a unstructured and more of a fluid conversation. So the idea behind having these sessions was that we do know that what's going on today in Lebanon is without a doubt having an impact on, we can pretty much say, almost every single person in Lebanon. And maybe for people that are directly impacted or at our closer geographic location to where certain incidences are taking place, it may seem to them that people that are at a further distance may not necessarily be influenced. But we do know from what we're seeing that everybody today is being affected by what's happening. So I'll give you a couple of ideas or a couple of points that we've heard over the last couple of sessions. And again, this is the first one we're doing as part of the alumni office, but this is maybe the 10th or 15th session that I've been doing between students, residents, faculty at the hospital and staff at the hospital and the School of Medicine and Pharmacy as well. So we do know that a lot of people today are presenting with problems related to sleep. A lot of individuals today, one of the biggest complaints that we see in adults, want to divide them. Adults are presenting a lot of times with difficulty falling asleep, which wasn't the case previously. A lot of increased anxiety, fear of tomorrow, fear of uncertainty. With children, we see that children and adolescents, there's a lot of increased aggression. The aggression can be verbal, it can be physical. So we see that children and adolescents are being more short-tempered, they're easily irritated. They tend to listen less to their parents and to their supervisors. Adults, أكيد as well, are more short-tempered. They're easily triggered. But we don't see that as much in adults for multiple reasons. It can be because a large proportion of the Lebanese population, sadly, has developed a kind of resistance or tolerance to this, because this is not the first traumatic event that has happened in Lebanon. And it's very sad to see, this may sound very contradictory. It's very good from if we want socio-demographic point of view. It's very disappointing and alarming from a psychiatric and psychological point of view. Whenever a trauma happens, the normal reaction is to become very distressed, very uncomfortable, very worried, very anxious, not to be able to function normally. But when we look at Lebanon, Lebanese are functioning as though almost nothing has changed. Bosses expect employees to come to work at a regular time. They expect them to work the regular number of hours. We expect children to go to school and come back, and if they hear an explosion or they hear a sonic boom, as though it's nothing and life continues normally. That's great from a socioeconomic point of view, but that's a very alarming sign of how desensitized people have become. Because to normalize the abnormal is a very dangerous thing from a psychiatric point of view. And this is what we refer to as collective desensitization. So التجرد الحسي الجماعي. This is something that shows that communities or societies as a whole have gotten to a point where they have experienced so many traumas and so many negative events that they no longer feel. نحن as Lebanese بنحب دايما نشوف حالنا ومن كلمة we are resilient. This is not resilience. I'm very sad to say that this is zero related to resilience. When we talk about resilience, resilience is about you going through a traumatic event, absorbing it, acknowledging what it has cost you, and moving forward. So we are deceiving ourselves into believing that we are resilient. But what traumatic event have we overcome? The financial crisis? We weren't able to overcome it yet, because immediately after it came the COVID. After the COVID, the August 4th Beirut explosion happened. So people didn't have time to overcome the COVID. We got out of the explosion, we got into the situation that we're in right now. So in reality, we haven't had the opportunity to absorb, to acknowledge, to process any of the traumatic events. And so consequently, what we're experiencing today is not a higher level of resilience. It's unfortunately and sadly a very high level of desensitization. We've become emotionally numb. And another indication for that, and this is something I always tell in any of the sessions that I give to students or residents, even to doctors and to nurses. If you go through the archive on the internet, on YouTube, any of the Lebanese news channels, Al-Manar, NBN, MTV, LBC, Al-Mustaqbal, Jadid, any channel that you want, go back to 97, 98, 99, 2000. Look at any explosion or any event that happened, and look at how graphics were always filtered. We didn't show people on TV in the way that they are demonstrated today. There was always a blurred screen. Today, since the time of the COVID pandemic, we show dead bodies, we show corpses, we show things as though it is a very normal experience. So the normalization of death, the normalization of losing humanity, the normalization of this entire violence that's happening in society has allowed us to adapt to it. Adapting is very different than becoming resilient. Adapting means we are accepting this as the new status quo. So how good is that? How good is it that today we are okay with death? How good is it that today we are okay with seeing thousands of people on the street and continuing life normally? How okay is it that we are okay with sending our kids to school when we know other schools have been demolished and other kids are now sleeping on the streets. And there's always, Akid, the counter argument that, and me and Abdullah and Ghada were talking about this before the session opened. There's always the counter argument from parents that, but it's important for our kids to be in school and it's important for our kids to continue with their education. I completely agree. But the more important question is, how do you define education? Is education just knowledge, al-ilm, or is it also civility, tarbiyah al-madaniyya? What are we teaching our children when we allow them to go to school and learn chemistry and math and physics and languages as though nothing has changed? What aspect of civility are we teaching them? What aspect of equity and equality are we teaching them? And then we're surprised about the discriminatory practices we see in our communities. We're surprised how people have differing opinions and different understandings of what is normal and what is not normal, what is socially acceptable and what is socially not acceptable. So before being surprised about these things, I think we need to revisit our understanding of what genuine and true education is. It's a very important aspect that we pay attention to, because what we teach our kids today, and as difficult as what we are going through today, as difficult as it is sadly a very golden opportunity for us to change the history of Lebanese community by truly acknowledging and unifying the upcoming generation. مش مثل ما كنا دايما نقول انه الاجيال اللي طلعت بعد جيل الحرب تربوا وتعلموا and we're not going to have the issues that we had anymore. Today, because of media and because of globalization, we actually have the opportunity to highlight the importance of civility and humanity. But we're not doing that. Not because we don't want to, but because we've sadly become conditioned, not resilient, to acknowledging that it's okay to go on as though nothing has changed. So I think one important take-home message before I open the floor to discussion, Akid, one take-home message that we need to understand, it's not okay to normalize what is abnormal. That doesn't make us resilient. That doesn't make us stronger. That simply makes us emotionally numb. It doesn't make us better people or stronger individuals. It's important to acknowledge that the first signs we see in troubled children or troubled adolescents is problems related to sleep, increased aggression. Increased aggression can vary. You see a lot of kids that are coming back presenting with biting. Parents are coming saying out of nowhere, my kids are biting again. There are problems at school with their friends. So physical aggression has increased. Bedwetting. الولاد اللي نطفوا قبل رجعوا هلا, they are wetting their bed during their sleep. These are two of the first signs we see in children. With adults, we know they are not okay when, and this is going to sound very controversial, when either they are completely living their life completely normally, because that means they are in an utter state of dissociation and complete denial of what's happening, and eventually they're going to have to face reality at some point. Or when we see that adults are presenting with problems mainly related to sleep in the evening, and Akid, red flags when you need to think about seeking professional help, be it a psychologist or a psychiatrist or even a life coach, is if people are having persistent thoughts related to death, to negativity, to seeing things as very black, as there's no way out of things. It's very understandable today that the biggest concern we have is what's going to happen tomorrow. I think all of us are constantly thinking about today we hear some good news, we expect tomorrow is going to be a little bit better, then something again negative happens. And I think the most important thing we need to keep in mind is that as long as we are in a traumatic event, there is no way of knowing what is going to happen tomorrow. The only thing we can reassure ourselves with is that every beginning has to have an end. When that end will happen, we don't have any guarantees. So the first important thing that we always need to do is make sure that you know where you are getting your news source from. Sadly, do not forget that most of the local, and when I talk local, I mean Lebanese as well as Arab, a lot of local news channels are politically associated. So when you get news from certain channels, they may have a political affiliation, which allows them to propagate certain news feeds. So it's very important to filter out where you are getting your news feeds from. The second important thing when it comes to news is always remember, what matters to a news channel is how many, the number of people that look at their feeds. The more individuals that look at a post, the better their ratings, which means higher income for a TV or a radio channel. And this is very important because to you, you think that these news channels are primarily focused on your well-being and providing you with the most up-to-date information. But that's a very selfish way of looking at things. In reality, they have their own agenda. Their agenda is to be number one in providing news. So please, please, please make sure that when you are getting your source of information, try to first of all, select reliable news channels. The second important thing that you need to do is minimize the contact hours or the contact time per day that you are spending reading or listening to news. A lot of people spend all day on the phone, not very far from me. In my direct social circle, a lot constantly are looking at night, which I understand at the moment. But you need to be able to set certain times. And this is what I gave in terms of recommendations for the students as well as for physicians. It's very illogical for me to tell you to not check your phones except once a day in the morning or in the evening. But set certain schedules. So if you're somebody that currently looks at their phone every half an hour, make it every 1.5 or every 2 hours. After a couple of days, space it down to every 3 or 4 hours and gradually work up the pace. But it's very important to isolate the times and limit the amount of time that you're spending on news, because this is basically what is allowing us to become extremely anxious, because you hear one thing on one news channel, then you hear something else on another news channel, and then you're caught in the dilemma of which one is correct. So you spiral into having to check different sources of information or different news feeds. So with that, and like I said, I will leave the floor open for anybody that has questions. For those that maybe joined a little bit late, again, I do prefer that you unmute yourself, you ask your questions, but for those that don't have access to a microphone, Akid, you're also welcome to ask your questions in the chat box.
Good evening.
Yes.
This is Monica Bazzi.
Yes, good evening.
I'm currently married and very recently, and I don't watch the news, to tell the truth, but this has been for long. And I spend my time either exercising, sitting under a tree, enjoying my day. And my husband finds it very weird that I don't watch the news at all. And I even ask him if it's possible for us not to watch the news at home. So I don't know what to do. It's like, am I really, at times I ask myself, am I trying to avoid it? Yes, I'm trying to avoid the news. I don't want to know anything about it. And I'm trying to survive like the rest of the Lebanese. But for my husband, this is a bit weird. So I don't know how to handle the matter with him. Because if I tell him do not watch it, he gets mad. And if I tell him, okay, go ahead and do it, it's like the house will become a bit an unhealthy environment. So I don't know if I'm doing the right thing.
Monica, do you have any children?
Not yet, no.
Okay, so I think first of all, to answer your first question about whether the way you are dealing with it is unhealthy or if it's not the correct approach, I think on the contrary, it's one thing to be completely disillusioned or ignorant of what's going on, and it's another thing to know where to set your boundaries. And in in the way that you are describing your things, you're not disillusioned, nor are you ignorant about what's going on. You're simply establishing a good boundary or a good space between you and what's happening at the moment. It's definitely a healthy approach. Exercise is always something that we encourage. Whenever people have the opportunity to carry out certain outdoor activities, that's something that we always encourage as well. Having good support systems can be the family, it can be a group of friends, it can be anybody that you gather with. These always tend to deflate or decrease the amount of stress that a person experiences. So from what you're describing, the answer to your first question is definitely the approach that you're using in no way whatsoever is inappropriate or it doesn't fit what needs to be happening. On the contrary, it's a very good defense mechanism. In terms of how to deal with things with your husband, I do think it will also come, it's related to the mentality. For a lot of Lebanese that were born and raised in Lebanon, listening to news and constantly following up on news is kind of the bread and butter of cities. A lot of people that were born and raised abroad, or they don't come from purely Lebanese backgrounds, news is something that is somewhat quantified. So whenever you talk to people that are in Europe or in the States or even in Africa or the Far East, they set aside an hour during the day, which is usually the evening, just to keep up to date with what's going on. So it's also a way in which people are brought up. Lebanese constantly read news in the morning, they read newspapers. Lebanon is one of the only countries worldwide where up till today, newspapers are still highly published and highly sold in terms of the paper form. And that's a reflection of how invested even the older generation is in terms of keeping up to date with news. So we also need to take into consideration the background of where you were brought up, where your husband was brought up, if either of you were born and raised abroad, versus the background in terms of the family. Did you come up in households where they also constantly watched news, or were you brought up in households where that wasn't the daily practice? But definitely, I think if your husband is comfortable listening to news, then you don't want to push to the extreme where you ask him not to keep up to date, because that's going to cause him to be distressed, and consequently, it's going to negatively reflect on your relationship with one another. So there has to be a balance of reaching a compromise where you may both maybe listen to news together, or when you're taking your time off, that's the time where he can listen to the news. Nai, you had your question, you had your hand raised.
Thank you.
Sure.
Yes, thank you. First,
Yes,
thank you for organizing this. I'm Nai Al-Halo. I'm currently based outside of Lebanon, but my family, friends, other people I care about are in Lebanon, living this too, and being directly impacted to different degrees. So some are, in the areas that are more heavily bombarded. Others, like family, they are in areas where they can hear, the aircrafts all the time and everything else that comes with it that, I don't even have to explain to anyone.
Yeah.
And as you said, a lot of people are desensitized, and we do have this pride where we do say that, oh, we're resilient, this is nothing, or it's nothing compared to other things that especially our parents may have gone through the many previous wars that they have gone through. And even for people who may not be, today getting bombed, they may have been in the past. So, and this might be the reference for them. My question is, as someone who is not actually living this, in the country, what are things that we can do to support on the psychological mental health level, our families and friends, especially when, we can hear the aircrafts through the phone, but they're still saying that, oh, it's nothing, it's still fine.
So this is a very good question. Maybe one of the important things to always keep in mind is that humans were created in a very complex manner, which is that sadly we are brought up not innately, but we are brought up across the globe, whether you're in the Far East or the Far West or the Middle East or Europe or Africa. we always reinforce, sadly, the concept of ego. Humans don't like to be helped, but in reality, that defies basic humanity. Humans need help in the at the very most basic level. No human is an electrical engineer, a chemical engineer, a botanist, an agriculturalist, a physician, a nurse, everything at once. We were created in such a way that everyone has a certain weakness. Thus, our ego doesn't allow us to acknowledge that weakness. So whenever you want to deal with people, you always need to reassure them in such a way that you show them you are giving them attention without actually highlighting their need for attention. Which means when a phone call happens or communication happens between you and them, don't كيفكم وشو اخباركم وسمعت هيدي الانفجار هلا صار ان شاء الله ما صار لكم شيء if you need anything. اكثر شيء بيكرهه الانسان لما يسمع حدا عم بيقول if you need anything وما تنساني وانا موجود وشو ما بدك وبيتي مفتوح, لانه humans don't like to feel vulnerable. Humans don't like to feel that they are in need, which in my opinion is something that we all need to revisit as humans. I know that at certain places, I worked on myself at that. For those that don't know me, Anna, I'm a type 1 diabetic, and I used to always hate when people used to focus on it. Now, whenever I give a class for new students, I tell them, if you realize that I'm not acting correctly, if I'm starting to talk in a way that doesn't make sense, if I'm making repetitive behaviors, that means I'm having a hypoglycemia. Don't tell me you're having a hypoglycemia, simply go get a glass of water and sugar. So we need to find a way, and to get you to back to what you're asking about, Nai, the way that you need to approach it is check up on them regularly, ask regularly, communicate with them on a very regular basis, but don't focus on شو ما بدكن أنا هون. Don't make them feel like you're reaching out just because they need help. By being a social listener, this is the best thing that you can do today for individuals, because some people just want to be heard. When you kind of normalize things, and when I'm saying normalize, it's not like pretending nothing happened. Normalizing means شو الأخبار, مش إنه سمعت صار انفجار بس إيه بعرف هيدي بعيدة عنكم أكيد ما هيك, لا. هيدا negative normalization where we think we're resilient. Normalizing is طمنيني شو الأخبار كذا. لما هن يقولوا لك من شوي طلع انفجار هون, حسيتوا فيها ما حسيتوا فيها, اوكي لا الحمد لله انتم منيح ومبين على صوتك you're okay, مبين انه منك تعبانه, and when they don't sound okay, acknowledge their weakness. مبين عليك اليوم تعبانه, شكله كان نهار صعب, بس ما تلحقوها بجمله شو ما بدك انا هون. People want to be heard. They don't want to be helped, even if they need help. So when they're ready to ask for help, they will ask for it on their own. I hope that answers your question, Mai. Rasha?
Yes, hello.
Hi.
Thank you so much. So my question is kind of related to the last point you were saying. So because of this war, unfortunately, a lot of people are being put in small places like school shelters, or even like people going and staying at a relative's house with them. And there is a crowd and everyone has different temperaments.
Yes.
And I hate to admit it, but us as Lebanese, we don't really know how to like deal with feelings, especially when it's someone else's feelings. So like when something happens, you have someone saying you're feeling too much and someone else saying you're feeling too little, and you're stuck in what am I supposed to feel in that moment, you know? And it can get really tough because like for a certain person, why are you crying? It's not that big of a deal. And for another person is, I can't believe you're so cool with it. You know what I mean? So how can we like not be lost in this loop and validate our own emotions? Because external validation is literally not an option. I have literally heard from people, I lost my home, unfortunately, and people called me and I was crying. Of course, I had to hold myself together to answer the phone, and someone hit me with, I feel إنه أنا مقهورة أكتر منك. And I'm like, okay. And أنا منهارة وأنت مش عم تبكي. And I'm like, no, I'm just not crying on the phone. You know what I mean? So how can we deal with such a situation? How can we validate our own feelings and not allow other people to shut us down?
So Rasha, I'm going to answer your question with a brief statement, which is you should never feel you need to validate your feelings, because whatever you feel is always what you should be feeling at that specific time. Nobody will ever experience the same experience in the exact same way, because humans today are the result of past experiences, past childhoods, past traumas, everything you've gone through. So even two siblings, if one was brought up in a certain way because they were the first child, so the second child was brought up in the same, in a different way, even if both of them lost the same house, you will find they react completely differently. That doesn't mean that one person's emotions are validated and the others are not validated. It simply means that each one of them's emotions are validated based on the experiences they had. So to very briefly answer what you're saying, you never need to validate what you are feeling. You are always justified in feeling what you need to feel. You are always justified, and a lot of people are going to disagree with this. But again, when I talk psychiatry, I put aside social, cultural, religious norms and expectations. Before religious and cultural beliefs and norms and expectations, you are a human being. And every human is the result of experiences, and those experiences will culminate in emotions. So a lot of times what you feel and what you feel like saying and what you feel like doing may not necessarily align with what culture or tradition or عادات or تقاليد أو القيم الاجتماعية usually tell you are appropriate or inappropriate. But from a psychiatric point of view, that doesn't matter to me. I'm not here to give a sociology lesson. I'm here to validate what you are feeling. So everything you're experiencing, you have the right to experience. The second question that you had, do not ever, like you said, expect validation from external sources. La if you are feeling too much, wala if you are feeling too little. As long as you know what you are feeling and you know what you're experiencing, then you're on the right track. I'm going to address two questions in the chat. وبعدين Khalid, I'll address your question because we're done with time. So Lana had a question: is it possible to recover from desensitization and numbness? Yes, we can always recover from desensitization and numbness. It's a process. It's not something that happens overnight. The process of recovering from desensitization and the numbness that we have, it doesn't begin today. It's once we get through the traumatic experiences that we've accumulated and we start the process of absorbing what has happened. So right now, sadly, it's too early to talk about overcoming it, but the positive is that we can overcome it, and we've seen it in history by a lot of people. They were able to overcome collective desensitizations in the past. Second question from Lisa: as you mentioned, it's not normal to normalize the situation. Then what is the substitute? We have seen the different versions of the war. It has already become normal for us. Yes, like you said, definitely we should not be normalizing. The substitute for normalizing is acknowledging what's happening. It's acknowledging that we are in a state where we are not okay. Most humans don't accept the idea, and I am not okay. And that's the biggest problem we face today. Why do we consider not being okay a sign of weakness? Why do we consider me needing to ask for help a sign of weakness? Why do we consider if I need to see a psychiatrist or a psychologist today a sign of weakness? For one reason, because we were brought up in societies and communities that tell us شد حالك, ما بدها القد, انت بتعظم المواضيع, know how to deal with things. But this is not the reality. The reality is it is okay to not feel okay, and we are all not okay. For those that are functioning on a regular basis, it doesn't mean that they're okay. We are all not doing normal. I know that I normally function on 6 to 7 hours of sleep. I'm sleeping between 8 to 10. that means I'm not okay. And I'm okay with saying I'm not okay. So we all need to accept that something has changed. Being okay doesn't mean that you have to be suicidal or be or crying all the time. Khalid, you had a question? Yes.
أنا سؤالي هو صراحة أنا ساكن براس النبع.
Okay.
أول ضربة ببيروت كانت حد بيتي، يعني بالشارع اللي قفل الشارع تبعي.
طيب.
وصراحة بقول لك يعني يعني لما صارت الضربة أوكي أنا تأثرت، بس إنه قلت خلص الحمد لله قطعت على خير. اللي ضايقني أكثر من كل شيء صار، يعني I wasn't traumatized يعني بالضربة قد ما إنه I was traumatized إنه تركت بيتي وطلعت برات بيتي. يعني أنا عندي إنه يعني فقدت هيدا إذا بدك الحس بالأمان بقلب بيتي. يعني لما طلعت صح أوكي رحت عند أهلي مثلا، بس بمجرد ما إنه أنا خليت عن المكان يلي أنا برتاح فيه وعشت برات بيتي لشهر أو شهر ونص، رجعت على بيتي على راس النبع. بس بمجرد ما طلعت أنا من هيدا السيف إذا بدك اريا اللي أنا محاط فيها، بلش كل شيء بعدين، كل استقراري النفسي والجسدي والعقلي كل شيء بلش يتراجع كتير. ومش بسبب الضربة، بسبب إني أنا طلعت برات بيتي. هلا لما رجعت لهون من هيدا الأسبوع، يعني من يومين 3، خلص كل شيء رجع تمام. يعني حسيت حالي إنه أنا مرتاح. فما بعرف، حسيتها شوي غريبة إنه ما تأثرت من الضربة قد ما تأثرت من إنه طلعت برات بيتي وما عرفت كيف أرجع رجوع، يعني أرجع على بيتي أرجع. كيف يعني شو بتقديرك مفروض، يعني هل ممكن شو اللي مفروض أنا أتوقع من هذه التجربة أو أتعلم منها؟
خالد، نقطة حلوة كتير. اللي أنت مرقت فيه واللي أنت عشته هو it's very 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 normal، جدا طبيعية لحيالله إنسان. دائما نحن لما نحكي عن حاجات البشرية نحكي عن شيء اسمه مازلوز هايراركي، اللي هي إذا بدك الهرم تبع الحاجات الأساسية الإنسان. وبالقاعدة الأساسية at the very base هي اللي نحن بنسميها الحاجات الأساسية البيسك نيدز. الشعور بالأمان، الشعور بالنوم، الشعور بالأكل، الشعور بالاستقرار. food, shelter, safety and sleep. هول إذا كانوا موجودين كقاعدة فيزيولوجيا الإنسان بيقدر يعيش. فإذا بترجع من أيام زمان لما كان الكهف كان محل أمان، كان يحطوا الأكل جوا، كانوا يناموا فيه. and this is where the idea came from. أنت اليوم إحدى الأساسات اللي هو المحل أنت بتعتبره أمان لك انهز. فلما أنت تظهر من هيدا الشيء أنت شلت القاعدة الأساسية اللي بكعب الهرم تبعك. طبيعي أنت تحس بعدم استقرار. لما انت ترجع على القاعده تبعيتك اتس فيري نورمال انت ترجع تحس انه رجع الشعور بالامان. the fact انه انت اذت الضربه وما تضايقت من الضربه هيدي كمان منا غلط. كثير ناس مثلك بيقولوا من الناس اللي شفتهم اللي تهجروا من الجنوب كلهم بيقولوا لك انه نحن اللي مضايقنا مش راح البيت بطون بيرجع بيتعمر، بس اللي راح الذكريات اللي بالبيت. الراح انا طفولتي اللي عشتها هنيك، الحديقه اللي انا صار لي 15 سنه بزرع فيها، المحلات اللي لعبت اولادي فيهم. هول القصص ليرجع الواحد على المقر الاساسي، ليرجع يقدر يحس انه رجعت على الاستقرار وقادر ارجع عمر ذكريات من اول وجديد. انت اللي مرقت فيه يعتبر ردة فعل طبيعيه، ما فيها شيء غلط او ما فيها شيء غريب، بالعكس it's a very normal reaction.
شكرا.
آخر سؤال من مايا وبعدين we'll end.
Hello, this is
Hi,
Maya. I have mixed up feelings, maybe because I live in an area that is relatively safe, if I could say. So during the whole period, we heard a couple of bombings, and mainly the aircrafts flying around. So I have a feeling of guilt because I still live my life normally, going to work, coming back home. Of course, there's anxiety sometimes when I hear the loud airplanes, the aircrafts, and for example, if I hear a motorcycle or a truck passing by, I think it's a bomb and so on. But apart from that, it's like I'm living my life normally. So I'm not sure if this is desensitization or if it's a feeling of guilt towards the other Lebanese who are in a more dangerous area, who left their houses, left their homes, their jobs, and everything happening. So I'm not sure how to deal with these feelings or at least understand them. If you could give an advice concerning this issue.
So Maya, I'll
Thank you.
start by answering the second question. أكيد it's not desensitization for one reason. Because you cannot, when you're desensitized from all negative emotions. And guilt is a negative emotion. So the fact that you're feeling guilty about other people automatically means you are not desensitized. You are experiencing mixed emotions. أكيد وهذا it's a defense mechanism. And in the end, if you are able to continue life, quote unquote, as possible, life has to go on. Because just to be clear, أكيد today, bringing everything to a complete standstill will only cost the economy more. يعني اليوم تنجي نقول because of what is happening, all restaurants should close, all malls should close, all supermarkets should close, everything should close. In addition to the crisis that we are living, we're going to put even more people into unemployment. We're going to increase a financial strain on the country. So أكيد مش هيدا اللي مطلوب. لما نحن نحكي عن living normally versus not normal, we're talking about الadded, luxury. So if I'm used to going clubbing or partying every Friday and Saturday, even if I'm in a relatively safe area, it wouldn't be very correct from a humanitarian point of view that I'm still clubbing every Friday and Saturday. But it would be very correct for me to gather with my friends at home. It would be very correct for me to have gatherings تنغير جو مع بعض. These things are not a sense of they're not a sign of desensitization. They're a sign of a healthy coping mechanism. So definitely you are not desensitized. Okay, just to clarify that. So with that, Anna, I will end. I'd like to thank Akid, Abdullah, Ghada, Manwa, the alumni office for organizing this. If anybody, Abdullah, if you would like to close, Anna, from my end, I'd like to say thank you, Akid, for the audience. Hopefully you guys benefited from the ideas that were brought up today.
So much for a wonderful session, very helpful indeed. I think every one of us benefited in a way from it. On behalf of the guests, of the alumni, of the attendees, we can't thank you enough. On behalf of my colleagues, Ghada, Manwa, the alumni office, LAU, thank you so much, Dr. Salame. We really appreciate your time. And I believe we have more sessions of the sort to come in this series. We'll keep everyone updated. And Allah yatik alf afiyah. Thank you, thank you, thank you.
Thank you, Abdullah.
And we're so proud of you.
One thing I'd like to conclude, which I always ask, if you guys have any specific subject or anything that is concerning to you, what I always tell is that you are always free and more than welcome to suggest topics. So you can reach out to me via email or to Abdullah or the alumni office and make certain recommendations for any future sessions that we can have. Well, thank you everybody for joining.
Thank you, Dr. Salame. Thank you so much. Thank you all for attending. Ghada, thank you.
Thank you. Thank you, everyone.